Welcome to this episode of Monday Morning Joe. My name is Dr. Joseph Mikhael from the Translational Genomics Research Institute in Phoenix, Arizona. Monday Morning Joe is a quick-hitting, coffee talk style 6-episode series on the latest and greatest in multiple myeloma. Please remember to subscribe to the Exchange CME YouTube channel and make sure your notifications are on. You don't want to miss a single episode. Today we're going to talk about the critical topic of health disparities in multiple myeloma. Thankfully there has been literally across the country, if not the world, a greater appreciation and understanding of health disparities in general in all of aspects of health, but now specifically we're seeing this in multiple myeloma. In fact, I would argue that multiple myeloma is perhaps the greatest and most disparate disease in cancer in African Americans. What I mean by that is that unfortunately, the survival rates of African Americans with multiple myeloma is literally half that of white Americans. And that's simply not acceptable to anyone. Before we can address a disparity, however, we need to understand it. And this is an incredibly complex topic. But let me remind us that this is a multi-headed beast, as it were. This is a multi-level problem that has taken hundreds of years to create. There are multiple layers, if you will, to health disparities in general and specifically in multiple myeloma. To recap simply, there are issues of systemic racism that pervade our whole society that influence these outcomes. There are issues of the social determinants of health. We can't just think about specific drugs and therapies. We have to look at the patient as a whole. I often say I don't treat myeloma, I treat people. And we have to look at all of those things. And a patient is not going to listen to your beautiful description of giving them bortezomib, lenalidomide, dexamethasone if their stomach is empty. And so the social determinants of health are very influential, and not to mention socioeconomic status. But furthermore, we see a deeper level of just the healthcare system in general. A recent database review of over 55,000 patients with multiple myeloma demonstrated that African Americans are more likely to be uninsured and to be on Medicaid than white Americans. And so the whole insurance platform can be a real challenge for patients and for their access to therapies. And then when we think about things that are a little bit more myeloma specific, the biology of myeloma influences disparities. Myeloma is twice as common in the African American population. The average age of African American patients with myeloma is about 4 to 5 years younger than white patients. The Hispanic and Latinx population are even younger diagnostically with multiple myeloma. And then a very important layer of disparity is that of delayed diagnosis. So we know that on average, any patient with myeloma, actually, independent of race or ethnicity, sees their primary care team 3 times with signs and symptoms consistent with myeloma before the diagnosis of myeloma is made. This is prolonged within African Americans and Hispanic Americans, partly due to lack of trust in the system, lack of access to diagnostic testing and to healthcare professionals, but also other things like confounding diagnoses that are more common in this population, like diabetes. So very often our patients are told, oh, that little bit of proteinuria, that anemia, that renal insufficiency, that's just your diabetes, when in fact it's myeloma all the while. And then lastly, although there were many more aspects to this, perhaps the greatest aspect of the disparity is in access. And access, what I often say to the big 4 T's, the 4 things that we know have influenced outcomes in myeloma: triplets, transplants, trials, and CAR T-cell therapy. And we've shown, sadly, that indeed minority populations, both the African American population and the Hispanic population, have less access to these 4 things. So thankfully, a lot of work is being done in the field. At the recent American Society of Hematology annual meeting, there were a remarkable number of abstracts looking at addressing these disparities, understanding them, and addressing them. There are programs across the country. This is a great passion of mine and something that I'm thankful to be involved with. As a clinician, it's important to demonstrate culturally sensitive care to your patients by listening to them and not prejudging them, understanding their expectations so that all of us together can work towards improving this system and improving the healthcare outcomes of all patients, independent of race or ethnicity. Well, thank you for joining me today. As discussed earlier, please check back for new episodes on the Exchange CME YouTube page. And also, you can go to the ExchangeCME.com site for free access to CME in a wide variety of therapeutic areas. Thanks again, and we'll see you on the next episode of Monday Morning Joe.